A study showing a previously unknown impact of air pollution on Utah children. We're talking about the smallest particles we measure in Utah's air, PM 2.5. Fox 13's Max Roth has a look at the results all parents should see.
PM 2.5 means we're talking about particles 20 times thinner than a human hair. We've always known the particles disturb the lungs, especially for people with asthma and other respiratory conditions. But this study grew out of one doctor's observation. She trained in Minnesota and then moved to Utah.
Usually at Primary Children's Hospital in January or February, there's a large influx of RSV cases.
Benjamin Horn and his colleagues at Intermountain Healthcare, the University of Utah, and BYU noticed inversion season sending kids to the doctor, and not just with asthma.
About 2 to 3 weeks after increase in air pollution, the PM 2.5 going up substantially, that there were an influx of cases into the hospital.
As our PM 2.5 levels elevate, we see a significant increase in infections, and this is troubling.
Troubling and puzzling. It's easy to see how particles from cars and industry would aggravate the lungs, but why colds, the flu, and RSV, all viruses? Cars don't get colds, refineries don't spew the flu. This study doesn't say why, but it makes a clear connection.
Germs and bad air quality combined will lead to infections.
So what's happening? It may be particulates weaken the children's immune systems, or it could mean children bunch up indoors and spread infections when the air is gross outside. It may be both, meaning parents need to watch air quality and remind kids of good hygiene to keep germs at bay. In the newsroom, Max Roth, Fox 13 News, Utah.
Oh, that's so interesting, isn't it? You know a lot about air pollution and the effects it has on the valley.
Yeah, unfortunately, we're moving into the season. We don't have to have as big of a concern for air quality. Summer, though, it comes back a concern.
That summer inversion, the summer haze.
I know. So we get it in the winter and in the summer.
Each do our part to help out.
That's right.
It is 6:27.